Hello guys, this is Dr. Patrick Price, and I am the Body Detective. Today I'd like to talk to you about something very painful. Lately I've been seeing a lot of this in the office, and many of you out there have probably experienced this. Some people would equal this type of pain to childbirth. So for men, if you like to know what it feels like to have a baby, just have one of these, which I highly do not suggest. It's called a herniated disc. A herniated disc is when your spine has usually experienced some type of trauma. This can be from a car wreck. It could be actually something that happened 20 years ago that was very minor. Some people just were hit from behind in a car and they received no treatment, no chiropractic, no physical therapy, no acupuncture, no massage. And so they kind of blew it off as no big deal. Well, usually in the office, when we see a herniated disc, it is usually from some previous trauma that was untreated. Now, some people do have a trauma they received recently, and we see them right away in an acute situation. But 9 times out of 10, this is like a micro trauma. Maybe you've had like a Jeep, people bounce around in a Jeep all day long. Okay, that's like a micro trauma. You're just smashing that little disc over and over again until it receives little tears in the disc, and then it becomes weak. Now, I would compare this to, say, a ballooned tire on a car. Have you ever seen a tire where it gets like a little balloon on the side when it's get out of balance? It looks like it's ready to just explode. Well, in your spine, this is what this looks like. You'll get a herniated disc and begins with a small bulge, and it can be asymptomatic, meaning you can have no pain, and you can go around for years this way. And one day you just turn your head and sneeze, or you cough, or you make one little slight movement, or even a sudden movement, and it just sets this thing off. And people says, I don't understand. How did this happen to my spine? Why do I have so much pain? And I didn't do anything. All I did was turn to get my car keys. Well, that is exactly how it happens. You have a previous fall, a trauma. Maybe you just hit really hard on your rear out of a chair somewhere, but it could be 20 years ago. Guys, like I said, most people we treat in the office is from a previous injury, even something so subtle that you just don't think it was a big deal. Now, I like it when I look at forms and people say past traumas and they put nothing, right? Now, past traumas, think about when you were a kid. First of all, you were born, you have plenty of trauma at birth. In fact, I just went to a seminar about newborns, guys. There's chiropractic organizations, they're set up. All they see is newborn babies and pregnant women. And I enjoy seeing this as well. But they demonstrated how when you were born, you have micro trauma, you have bleeding in your brain at birth. There's all these neurological tests you can do to see how the baby's head tilts and how its eyes and how its body makes these movements. There's all these neurological tests. The medical world just kind of shuns it off as like, well, this is just adaptations and they'll grow out of it, right? Well, maybe they don't grow out of it. Maybe later on you start having like a learning disability. Well, now we know there's plenty of treatments, cranial, sacral, fascial type movements to help newborns from the trauma they received at birth. So what does this have to do with the herniated disc? It has everything to do because at birth you receive major trauma being born into this world. So your trauma first begins, twisted neck, twisted spine, fascials all twisted in the body. And think of how you're born. Maybe the doctor pulled you out with these big old salad thongs, yanked you out of the mother, right? There's all kind of ways a baby is born. Truthfully, the old days was probably the best way of being born at home with your midwife in a birthing pool in the right position in a relaxed atmosphere without a lot of drugs drugging you up. Now I understand there's emergency situations and you need to go to the hospital, but the birthing process should last 12 to 15 hours. And once again, I'm relating this back to the herniated disc because this is where it all begins. If you have a twisted spine, you get spinal cord damage at birth, which many of us do. This is where a lot of these things come from birth, from other minor accidents. I like the one lady one time, she put no traumas, and her next visit I go, it looks like you've been run over by a car or something. Said, oh yeah, a couple of years ago I was in Mexico and I was drugged underneath the car for like 100 feet. I said, well, yes, this might be something you want to mention to me, that's a trauma that you had. Or one person says, yeah, no traumas. Oh yeah, that horse I fell off of. I fell off the horse and then the horse fell on top of me. But I just forgot all about that. So we all have plenty of traumas. But let me show you something. I'm going to screen share a picture for you. I don't want you to check this out. Everybody see this? So what is a herniated disc? Okay, we look at the normal disc. Look at the nucleus pulposus. You see, it's like you have the soft edge on the outside, the hard center, right? Then you have the spinal cord here, and they have the disc annulus on the outside as it's showing you, right? So with this disc on the inside, it's like a goo, it's like a gel, right? And so as you look on the right to your screen, you see that the disc gets out of proportion. It gets over to the side because it's been compressed. Maybe you used to squat heavy weights. This will surely give you a disc eventually. And that disc will begin to bulge. And as you see, it's pushing on a nerve. You see the compressed nerve roots, right? This is pain. This is called a space-occupying lesion. So when you put space on a nerve, which needs to be free, needs to have room to move, your body will react by having all the muscles contract violently in this area. You'll have your spine suddenly lock up because your body has this mechanism to protect the nerve. And so all those muscles around that region gets into a compromised position of protecting the nerve. Your body is trying to resist having any more nerve damage. Now, what does this look like on an MRI? Well, the picture you're seeing, this is a herniated disc. And as you see, the dark material is the disc. The bones are there, right? And so if you look in the back where that red arrow is, it's showing you the bulging of the disc. Now that white material is the spinal canal. So back here you have the spinal canal. Now the nerves that go down the spine, your spinal cord actually only goes down to about L2 in the spine. So you have this still spinal canal, other nerves are going through here, and this disc will push back here on this material. And let me tell you, some people can walk around with this. They have different levels of it and have zero pain. And like I said, one little sneeze, one little movement, one little long trip sitting in the car for 8 hours, and I'll set this thing off. But let me tell you, when you finally have a herniated disc, I'm speaking to the crowd out there because this is what got me in this field, is herniated disc, right? There is no pain in this world like a herniated disc. And whenever you start having this pain, you can take ibuprofen, Tylenol, things like this. This may give you some relief over the counters. But even the strongest painkillers, besides, say, morphine, something that just takes you out of your mind, this pain persists day and night, 24 hours. It is a pain you'll never forget. And it's one of the pains, really, I don't wish on my worst enemies, right? Because this pain is like imagine someone having an ice pick and just stabbing you right in the back, right in that spot over and over again, and just not letting go. And that pain will actually go down and radiate down your thighs. Now, they'll call it sciatica at times, when you have the pain into the buttocks, down the thigh. But still, this is a disc compromised. Remember, people call it sciatica, but still a disc that's being squished in the wrong position. Disc will herniate to the side, to the back corners. It herniates in different positions. But once this thing herniates completely, you'll get nerve pain all the way down to your toes. And you have these things called dermatomes, which are areas of the body that helps us identify where the disc is being compromised. So L4, L5 are very common areas. L5, which is the last vertebral bone, and the sacrum, that is an area. When I had my injury years ago, I basically exploded the disc. I didn't just have a bulge, I ruptured my disc. And so I actually lost the use of my legs for a while, and I lost the ability to do martial arts, which is one thing most of you out there know that I love. So chiropractic basically gave me my life back, doing chiropractic adjustments. Now guys, I don't mean just going there and getting somebody to go in there and go, all right, like you see all these videos, wow, look at this chiropractor, he did this one neck thing and everything went away. Well, that's magical if that happens, but it doesn't always work that way, guys. The arts of kinesiology, this is the real thing I want to tell you guys about. If you have a herniated disc, please don't go run and have a surgery right away. You try everything possible before you have a surgery, because you're in such intense pain. Like I said, childbirth pain. So men, I'm talking to the guys out there for a sec. Guys, y'all are such babies with pain sometimes. Women can take more pain than men any day of the week, right? So guys, we get a lot of pain. We're like, oh, baby, yeah, I want out of pain. Well, I do too. But let me tell you, If you go run and have a surgery, and once you open up your spine, if you watch a spinal surgery, how they tear those muscles away and tear tissue away, and you open your spine to the outside air, you lose this zero gravity like compression you have from movement. Any joint has this kind of 0 point gravity of movement. So your spine's never going to be the same. Even if they take out the disc and they fuse the bones together, now you're going to have a problem somewhere else. If you take the lumbar spine and you fuse those together, you're going to stop moving there like you normally move. Each bone has 3 ranges of movement. Your spine will flex and extend, rotate, and laterally flex. Each bone has its own individual movement. So as soon as you limit that range of motion, you make 2 bones become one piece, what do you think is going to happen? You're going to create another problem. You're going to have problems above it or below it. And then one of the unknown things, even in the chiropractic world, is if you have pain in your lumbar, let's say you have a disc pain, let's say it's L5 at the very bottom, well, there's a coupling effect, which means as your lower body turns one way, your upper body couples. There is this counter rotation happening. So your body is responding to itself. It's doing these opposite interactions for balance or homeostasis of the spine. So if you have a bottom bone, an L5 that's out of place, even an L4, you can always go and look right upstairs at the first bone, which is the atlas, or the second bone, C2. So you'll find that there's a secondary issue here. Now, when you have pain, so, well, doc, it hurts right here. Or people come in with a herniated disc, it hurts right here in my neck, right? Well, most of the time, if you're using kinesiology, muscle testing like we do, you'll find that that's not where the problem is. Even though it hurts right there, like, look, stick the needle here, give me the shot here, give me that steroid shot right here. Well, that's not always where the problem is. You have to think of that coupling effect, how your spine communicates, how the bones communicate to the muscles, how the organs communicate to the muscles. And when you look at this properly, you'll find out that that is not the problem, or the lumbar. That is not the main issue. You have to usually go to the opposite end of the body to find the issue. And so to help a herniated disc, guys, is you have to do specific exercises. There's other videos I have about lumbar spine especially, and cervicals, but I'll probably make some new ones, some updated ones for you guys to see. You need to exercise at home in a very specific way. You need to get up and out of bed a very specific way. You need to do everything to take pressure off that disc to create space. And yes, you can do traction. You can do the inversion tables and these things. The inversion table is probably not best doing an acute phase because all the muscles are in such spasm. But ice is always your best friend, not heat. Yes, I'm not against pain. Believe me, when you're in this kind of pain, you're willing to do everything to get out of it. But chiropractic, massage, acupuncture are the go-tos that I recommend, because I'm in the club, guys. Being a chiropractor, at least I get it for free because I'm a doctor, right? But you don't. You're going to pay for this service, so pay for your services in a way that you'll benefit the most. And that means getting someone who can strip out that fascia properly, where the fascia covering the muscle is so tight, the acupuncture hitting the right meridians to release the chi that's blocked in areas. And not just the adjustments of the spine. Sometimes when someone's so much pain, guys, we don't even move the bones a lot because you have the kinesiology. My own system is called Applied Kinetic Science. It's a form of kinesiology that's going to look at opposites. If this shoulder is something going on, it's affecting my neck, my disc here, it's going to be the hip on the other side that I need to check. And it's all by reading the body. So guys, if you have a herniated disc, before you run into a surgery, make sure you do everything possible. I don't mean go, well, I tried chiropractic, I had one adjustment, it didn't go away. Well, you have a herniated disc. This may be 2 to 3 months minimum of treatment before that disc the space will never really have that disc going back in completely. The bulge will always be there, right? But the muscles around it will relax. The inflammation, the swelling will go away. And this is what your goal is. They get this, and then the body relaxes those tight muscles, and the bone can begin to move properly in its proper range. But unfortunately, guys, when you have a disc injury, it is something that you may have to take care of the rest of your life. You may have to always monitor it. And each bone, each segment that it's at, has its own set of organs and glands. So if you have a low back injury with a disc there, you can almost guess that you're having bladder and colon issues. You're constipated, right? Things like this. This is typical. So guys, with herniated discs, I'm Dr. Patrick Price. Use your mind. Don't just overreact to pain. and just have a little patience, and your life will turn back to normal in a short amount of time. Herniated disc, guys, do something about it. Just don't take those painkillers, okay? Have a great day.